Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
Let's move to the junior doctors' strike. There is a central sort of poisonous misrepresentation which I think has made this a particularly bitter dispute, which is your assertion that the 11,000 extra deaths at the weekend are connected with poor staffing by junior doctors in hospitals. That drives them absolutely insensate with anger, and it's not true.
Well, the truth is that junior doctors are right to say that as we deal with the higher mortality rates at weekends, it isn't just about junior doctors. It's about being able to get diagnostic tests back at weekends. It's about consultant cover.
Yeah.
But if you look at, we've had, I think now 8 studies in the last 5 years, and they all say that staffing levels at weekends are one of the issues that needs to be seriously...
One of the issues, but not... And Sir Bruce Keogh, who did the report, has said that it would be rash and misleading to suggest that these deaths are avoidable by changing staffing.
He actually said that it would be rash and misleading to say that you could avoid every single one of those deaths. But he is also very clear that staffing levels matter. And I think one of the unfortunate misunderstandings, junior doctors work incredibly hard. They are some of the hardest working people who do some of the most weekends and nights. And we need to support them to do their job better. I think when we deliver a 7-day NHS, and this in the end is about making the NHS the safest, the most high-quality system in the world.
I mean, you have connected those excessive deaths to the whole question of rostering and junior doctors, and that is what people think is misleading, because it's a much more complicated situation than that. Many of those deaths are caused by the fact that people who go into hospital at the weekends are already iller, and therefore much more likely to die. And Sir Bruce Keogh and many others have said you can't connect the number of deaths to rostering questions, and yet you have.
Well, that's not true. If you look at those studies, let me just tell you, if you look at the studies, and we've had studies that came out by Fremantle last September, we had the study that came out by Professor Aylin just before Christmas. They all say, the Royal Colleges say, that you have got to look at staffing levels. We have 3 times less medical cover at weekends. Now, we're never going to have the same levels because there are going to be lots of things, and I think this is another misunderstanding, I mean, lots of things that we don't do at weekends, hip operations, knee operations and so on, but for urgent and emergency care. If I give you one example, which actually relates to senior doctor presence, the clinical standards, and this is all about making sure we meet the clinical standards, they say that if you're admitted to hospital, you should be seen by a senior doctor within 14 hours. That currently only happens in 1 in 8 of our hospitals. Now, if we want to promise, if we want that happens across 7 days a week, if we want to promise every NHS patient, as I do, that they're going to get the same high-quality care every day of the week, then we have to look at these issues.
I definitely want to return to that, but just to stay on this central question of misrepresenting the position of junior doctors, I can quote to you 2 things you've said. There are 11,000 excess deaths because we do not staff our hospitals properly at weekends, and you've said that excessive overtime rates give hospitals a disincentive to roster as many doctors as they need at weekends, and that leads to 11,000 excessive deaths. Against Sir Bruce Keogh, who did the research, who says it is not possible to ascertain the extent to which of these 11,000 deaths may be preventable. To assume they are avoidable would be rash and misleading. So when the editor of the BMJ accuses you of misrepresenting that report, she was right.
She was wrong. And if you look at what Bruce Keogh said there, he didn't say that what I said was wrong. He said it's wrong to say that you could avoid every single one of those deaths. But he also confirms that that staffing levels are one of the issues that need to be investigated amongst many other issues. And look, in the end, it's intuitively a very sensible thing to observe that if you don't have enough senior doctors when people are admitted to hospital at weekends, if you're not able to check, for example, the most vulnerable patients twice a day, which is what the clinical standards say, then your risk of a death that could be avoided is higher. And so I came into this job wanting to make sure that we offer the highest standards of care for every single patient. And I think the sad thing about this is that, you know, we're going to have a strike on Wednesday. And actually what I want to do is what every single doctor wants to do. They want to give the highest standard of care to their patients. And what we should be doing is sitting around the table discussing how to do this, rather than withdrawing care from patients, which can only harm them.
You have said again and again the phrase senior doctors. Why go into head-to-head confrontation with the junior doctors, who are the very people who are actually staffing hospitals at the weekends and, you know, who are not responsible for 11,000? Can we agree that they are not responsible for 11,000 deaths in hospitals over the weekends?
I think there are a number of things that are
Could
leading
we
to
agree
these.
that to start with?
There are a number of things. If you look at the study, I think, you know, you're saying to me that we need to be very careful with our words. And if you look at the studies, they all say there are a number of factors that need to be investigated, including staffing. But if you just look at this contract, and I think there have been a lot of misunderstandings, but look at the crucial issue of pay, because I think this is something that worries people. We are being absolutely clear that we don't want to cut junior doctors' pay. In fact, for the majority of them, it will go up.
Well,
if you look at the...
sorry, just on pay, you said something that I don't understand at all. You have said that this is revenue neutral. You've used that phrase. It's not going to cost any money at all. And you've said that 75% of junior doctors are going to be paid better, have more money coming in, and the rest won't be worse off. That is mathematically impossible.
Well, in the short term, as we transition to the new contract, it will actually cost us more as we protect the pay of people as we move to the new contract. But when we move through to the new contract in 4 years' time, the total amount going into the junior doctor's pay packet will be higher, not lower.
So it's not revenue neutral.
So, it will actually, you know, in the end, if you're going to ask more doctors to work at weekends,
you're going to have to pay more money.
You're going to have to pay more. But in order to be able to afford that, to do that in a way that's affordable for the NHS, we do need to reduce, this is a very important point, we need to reduce the premiums that we pay at weekends, make up for it with an increase in base pay. But even after these changes that we're making, junior doctors will get a higher premium for working at weekends than the nurses working in the same hospital, than the ambulance drivers who take people to the hospital, than the porters, than the cleaners. It's a good deal for junior doctors, but most importantly, it will make care safer for patients, because what we need to do is to make sure that our hospitals are properly staffed at weekends.
If it's such a good deal, why do you have to protect their pay for 3 years?
Well, because what we're actually doing in this change is we're giving more rewards to people who work the nights and the more frequent weekends. And I want to make sure in the transition, it's a very complex business, that there are absolutely no losers. What we'll end up with is a contract that is better for patients, but also better for doctors. Now, if you're a junior doctor at the moment and you go to work at the weekend, you will find in an A&E department we have half as many consultants on a Sunday as we do in the week. And no, let me just finish. This is very important. So it's a very stressful experience. Now, what I want to do is for a junior doctor to know when they go to work, whichever day of the week, they're going to get the support that they need to be able to give the best care to patients. And, you know, this is obviously very challenging. The BMA is a very formidable union. I mean, the health secretaries, if you look at the battles that Ken Clarke had, that Nye Bevan had, you know, health secretaries have these battles. But what history judges is, in the end, have you done the right thing for patients?
Well, let me come back to that, because again and again you've used the phrase senior doctors, and the Keogh report makes it very clear that if you're going to get better care at the weekends, you need not the junior doctors simply, but you need the consultants. I know this is a cliche, sorry, consultants, off the golf course and back into the hospitals, and you need the people doing the bloods and the MRIs and the nurses and the people running the pharmacy and all of them. So where is going to be the great battle to get them doing 7-day working as well?
Well, they are absolutely a vital part of it, and we're having negotiations with the BMA on those. They have been a bit more constructive, and those negotiations are ongoing, so I hope we'll do that. But if you look at what Sir Bruce Keogh, what the Royal College is, what Sir David Dalton, who runs Salford Royal, which is one of the hospitals that has successfully introduced 7-day care, they say that you need senior decision makers. That could be a junior doctor towards the end of their training. Junior doctors are actually in training for very many years, but you need experienced doctors. That'll be consultants, it'll be junior doctors with experience.
So you're going to make consultants come in on Sundays and Saturdays as well?
We have said that we will have to remove the opt-out that consultants, that junior doctors don't have, but consultants currently have, which means that they're able not to work at all at weekends. Okay. And, you know, the goal here is, this is, I think, important, because I feel what's happened with this junior doctors debate is that we've lost some of the big picture. This is actually a year of opportunity for the NHS. In the spending round last autumn, this government gave the NHS the 6th biggest increase in its budget ever. We've just had a really tough period.
I will come to the aggregate.
Okay,
figures, I
and
promise.
my point is that we have an opportunity now to actually turn the NHS into the safest, highest quality healthcare organisation in the world, and that's what I'm absolutely determined to do.
And yet, somehow, you have absolutely outraged junior doctors in all of this. Let me read you a few things they have said to us. We've been talking to some. Rachel Clark, who's a doctor in Oxford, says, Mr Hunt has made me feel demoralised, insulted and cheap. He implies we're the problem. When I give my life to the NHS, it's so grim on the front line now, I sometimes work 14 or 15 hours straight without a second even to eat. I have never felt so despairing or so close to quitting medicine. Andy King, a registrar from Oxford, with so many patients to see, I'm absolutely petrified. I'm too exhausted to look after them safely. If we are stretched even more thinly over 7 days, I'm certain patients are going to die. This is what they're saying. One final one, Jane Genyon from Hereford. The profession is at absolute breaking point. I see doctors in tears because they are so despairing about what the future holds. Jeremy Hunt has done this. He's driving away a whole generation of doctors. Those are the voices of doctors right now. That's what they feel.
Yes, and it's incredibly disappointing that the totally irresponsible way that the BMA has behaved in refusing to sit down and talk about how we can improve patient care and spreading misinformation that those doctors, for example...
They have been hoodwinked. That seems to be their personal experience of daily life, not what the BMA is telling them.
Well, one thing I would agree with them and the BMA is that quite outside the contract, we need to do a number of things to improve the morale of junior doctors, and I think there's a lot we can do with respect to the training. But what I would say is, one of the reasons for that anger, and there is anger there, is because they were told by the BMA that their pay was going to be cut. It isn't. They were told that they were going to be asked to work longer hours. They aren't. We're actually bringing down the hours they work. And if you're told by your union that the health secretary wants to do these awful things, of course you feel devalued. Now, the way to restore morale in the profession is to sit around the table, discuss what is the right thing to do for doctors and for patients, and also to look at the bigger picture, which is record resources going into the NHS. As I say, the 6th biggest increase in funding in 1 year in the history of nearly 70 years of the NHS. More doctors and nurses than ever. A total commitment by the government to making the NHS the highest quality, safest healthcare anywhere in the world. And, there are always battles along the way, but I think what history will ask is, did the health secretary, did the government that's committed in its manifesto to 7-day services, did they do the right thing for patients to make care safer and better? And if they did, in the end, I think doctors too will say, well, there was a big argument over it, but it was the right thing for the NHS.
Just on the 8 billion you mentioned, the King's Fund says that will not fund this 7-day thing. Most of it's already been spent. So you're going to need more money. Two things on that. One, are you really sure in your heart of hearts that your language on this has been adroit?
Well, I think my language has been extremely careful because I've always wanted to make sure that people understand how hard junior doctors are working. What I can't control, as you know very well, we have a free press and often my words are distorted by the BMA, which is, one of the cleverest trade unions in the book, because they know that in any argument between doctors and politicians, the public are going to side with the doctors. But in the end, look at the big picture here. The NHS has come up...
The big picture is, I'm sorry, is that they are still absolutely furious with you. 98% of these highly educated, hard-working people have voted to strike. And it can't be everybody else's fault but yours, surely.
No, look, I take responsibility for everything that happens in the NHS. But, what I also have to take responsibility for is the care that we give to patients. That's the most important thing for any health secretary. And I think the big picture here is record resources going to the NHS, record numbers of doctors and nurses.
I'm sorry, record numbers of doctors doing their 2 years basic training and then going off to find a job somewhere else, because 50% now leave to do something else, don't go into the NHS because they are so horrified and demoralised before they even start.
Well, Andrew, I think it's really important that you don't make a snap judgment about what's happening to doctors in the heat of a very difficult industrial relations dispute. We have 11,000 more doctors than 5 years ago. This is a moment for the NHS to pull together. And in the end, doing the right thing for patients is the way that will help the NHS go from strength to strength.
Last question, I promise, on this. Have you got more to give them when you meet them next?
Well, our door is open. I've said that the single issue that we are still loggerheads on is this question of unsocial hours on Saturdays, and I've said my door is open. I'm happy to do that. The BMA are saying they don't want to talk about that. What I say is, you know, rather than cancelling more operations, come and talk.